Good evening and thank you for keeping it TV 47. This is Body Garage with I, Sheila Chelangat. And now every January is earmarked as the Cervical Cancer Awareness Month, just to raise awareness about cervical cancer. And so tonight on this episode, we delve into cervical cancer, and helping me do that in depth is Dr. Maureen Owiti. Hello, Dr.
Hi, Sheila. How are you?
I am doing good. You look lovely.
Not better than you.
And of course, true to our show, we normally bring the real life stories of people who have undergone different diseases. And of course, in this particular episode, cervical cancer. And they are two champions, Rose and Christine. I would love for you to kujitambulisha. Tuanze na wewe, Rose.
Okay. Hello everyone, naitwa Rose Adero, cervical cancer warrior.
Thank you once again. My name is Christine Maloba. This year marks my 10-year survivorship of cervical cancer. Yeah.
That's amazing.
Thank you.
We will get back to the two of you in a few. Let's begin with you, Daktari. We're talking about cervical cancer. First, where is the cervix? What is cervical cancer, and who is, prone to get it?
Okay. I think it's one of the medical jokes, because cervix, actually there are two. Cervix just means a neck. And you have a cervix here, that's one. But I think the cervical cancer we're talking about is in the reproductive organs. So cervix is the entrance to the uterus. So it's one of the internal reproductive organs, so you can't see it from the outside. We doctors normally do a very uncomfortable exam. Women don't like, we call it a speculum examination. So we just have a special device called a speculum, which when we insert in the vaginal tract, we're able to visualize the cervix. So it's an internal organ, so you have to go in into the vagina, so through the external genitalia, that's when you're able to see the cervix.
Okay. And with that, who now can develop cervical cancer?
So in principle, any woman who has ever been sexually active, and please note human papilloma virus, when we talk of sexually active, it's regardless of the type of sexual activity. We're in a very interesting age whereby we have same-sex couples, and even women who are in what we'd call, say, lesbian relationships are also prone to getting cervical cancer, because we know majority of cases are spread by what is known as the human papilloma virus. So just that we know the HIV virus, it's HPV, that causes cancer of the cervix. The most common strains that cause cancer of the cervix will be 16 and 18, though there are many other strains that can cause it. And this is normally spread via sexual contact. Yeah.
Okay, so it's basically women who are already sexually active. Then my question then would be, how does it develop and what causes it?
Like any infection, you have tissues which are damaged, or the virus is able to get entry into those tissues, and then it starts replicating. So most virus, how they exert their potential is that they keep replicating. They keep reproducing or dividing and producing more and more and more and more. So from one virus, all of a sudden you have 10,000, a billion, like that. They keep replicating and becoming more. But the human body, especially like for young women, we have what is called our own immunity or our defense mechanism. And in majority of cases, you find that even if the virus has entered the body, your body is able to fight, and we don't get any problem because of the virus. But over time, so you find maybe for whatever reason you have a weakened immunity. So we have populations, let's just say our HIV populations, we find we have very strict screening schedules for them, because of their reduced immunity, they are more vulnerable towards other viral infections. And HPV is one of them. You don't have to have a lowered immunity to develop like HIV to develop cervical cancer, but something that's making your immunity go down. So things like even diabetes, other cancers, and just smoking even would lower your immunity, and alcohol. So if at a particular time, so you find, one, it spreads very easily. So even without penetrative sex, you're actually able, that's why lesbian couples are still prone to get it. You can get the human papilloma virus. So for whatever reason, over time, and it takes about 3 to 7 years before you can get severe changes, your immunity is lowered, and it'll now start exerting changes that will make you now get the actual cancer. So I just don't want to be too technical about it, but it just keeps making the cells, now they now get into that cancerous change.
Okay, let me bring you in, Christine. You said you've lived, it's now 10 years.
Yeah.
So I would want you to tell us, how was your experience when you were diagnosed with, cervical cancer? What went through your mind, and what are some of the symptoms that you had experienced?
Okay, my journey through the cervical cancer started in 2015. It just started as the normal menses, the way you just see the normal menses. Then I was like, no, this is too much. It went, like our normal menses, they go like 4 to 3 days. But now this one, at that particular time, it was like, it was an abnormal bleeding. So it took time for me to understand what was going on. But now this bleeding was too much that I became anemic. So the doctors didn't know what the bleeding was. They thought I had a miscarriage. So they took me in for tests. But at that time, the doctor had some tests on me, and he came to find out that it was not miscarriage. But one thing I liked about it, said that I'm ruling out cancer at your age, but let me give it a try. So that try, it's that try that saved me. He took some flesh, then that flesh he went to Nairobi University. For 2 weeks later, the results were that I had cervical cancer, stage 2B.
Cancer.
Yeah.
Ah, okay.
Yeah.
It was just a try.
A try, yeah.
Kwako pia we Rose, ni miaka 10 sasa. How was it for you? Ni symptoms gani ambayo uliweza feel and then it made you maybe go for the test?
Okay, mi upande wangu ilikuwa different. Sikuona symptoms zozote kwa sababu penye nilikuwa nafanya kazi, at least every year tulikuwa tunafanyiwa free screening, pap smear. My company tulikuwa tumepartner na organization fulani by name Faraja Foundation. So every year mwezi wa 10, being a breast cancer month awareness, tulikuwa tunawasaidia na donation. Tunaongea na customers, specialists and cashiers. Tunawaelezea about cancer, wana donate. Nao wakawa na give back to us kutufanyia free screening. So mwaka wa 2015 walikuja wakatufanyia free screening. Majibu ikarudi yangu haikuwa clear vile. So nika-advisiwa, nilienda kwa company doctor, akani-advise niende nifanyiwe more test. Nilimit gynecology, my dear Maureen, thank you, Dr. Maureen.
And that is the surprise of this show. So she was your doctor?
Yeah. So aliniangalia na akani-advise kufanya biopsy. Nikaambiwa, Rose, uko na cervical cancer na ni stage 1B. I was shocked. Hakuniambia hivyo direct. Aliniuliza umekuja na nani? Nikamweleza, akaniambia nao nataka kuambia umepatikana na cervical cancer. But si kitu. Tunaenda kufanya operation in 2 weeks.
In 2 weeks time. So, ningependa ushikilie tu hapo. Okay. Now, she says that she didn't have any symptoms. For Christine, it was that she had abnormal bleeding. So, for somebody, what are some of those symptoms that they can look out for? And first, is it normal not to have any symptoms?
Okay. Majority of cancers, unfortunately, especially the very early stages, you actually have zero symptoms. So you find by the time somebody actually does have symptoms, cervical cancer, they most probably are very advanced stages. And I'm very happy for Rose that she is with us today because of doing something simple called screening.
Yes.
I know a lot of people are very scared. They're like, oh, I don't want to be given a diagnosis of cancer. Yet you don't realize that by doing this, you may actually save your life. I think by that time, 2016, research in our department, you find that majority of cancers, we diagnose them when they are those stage 3, stage 4. And you find the 5-year survival rate for such patients is very low. Within 5 years, most of those patients will no longer be on this earth. So I'm very happy to see that I actually have a patient I treated in 2016, and she's still with us today. And I'm telling you, she's with us today because of going for screening. Had she not gone for screening, she most probably would not be with us today. Yeah.
So are there any other symptoms?
Okay. So I was even listening to, it was Jane? Christine's story. And Christine's story is not the typical story. Majority of women, what they present with is like the way she was presented was not even more like fibroids. So even why the doctors were saying they were trying is that her symptoms were not classical. Like the way she said, could have been a miscarriage, fibroids. That would be the typical presentation of what she's saying. The classical presentation for cancer, and unfortunately it's advanced cases, they normally present with a foul-smelling, watery discharge. And then normally during or after intercourse, we call it post-coital bleeding, they bleed. So a woman is with her partner and they engage in what partners are supposed to engage in, and after that they start bleeding. In people who may be, for whatever reasons, like widows or you're single, it can happen that maybe when you're going for a long call or a short call, you now notice that you're bleeding. But people who are having such symptoms tend to have very, very advanced stages. So you're talking about your stage 3, stage 4 type of cancer. So I'm so happy that we've saved a life because of screening. So I think what we must repeat 1,000 times in this in this show, please go for screening. Please go for screening. And mine is to reassure majority of people that you go for screening. Majority of cases, we actually are able to detect pre-invasive lesions. So that means before you actually get the cancer, their lesions we're able to see on the cervix that we can treat. So you don't even have to go through what Rose went through, whereby I'm sure we did a hysterectomy for her. Yeah. So we are able to do minor treatments, just remove a very small part of the cervix, or we're now actually ablating them, and the lesions go away and you don't develop cancer of the cervix. And there are those, yes, we'll get, but if we get early stages, you can see 10 years down the line and we're still here and looking so beautiful.
And Doc, that takes us to our first commercial break. We end this part by saying that you should go for screening. And of course, do keep it at TV47 and Body Garage to now learn more about the types of cervical cancer and then hear more from Rose and Christine about living with it and the treatment that they had to go through. Do not go too far, but first take a look at the facts and myths board of the day. I do not need a screening if I don't have a family history. A lack of family history doesn't mean you will not develop cervical cancer. I do not need a screening if I have had the HPV vaccine. You should still get regular screenings even if you've had the HPV vaccine. I don't need a screening if I'm not sexually active. You should get screened even if you're not currently sexually active. Thank you very much for keeping it TV47 and of course Body Garage, where on this episode we are delving into cervical cancer awareness, being that January is the month earmarked for it. And with me is Dr. Maureen Owiti, as well as two champions of cervical cancer, Rose and Christine. Doc, before the break, we have touched on the symptoms, and I've heard both Rose and Christine mention that they were told this is type 1, this is type other type. So how many types of cervical cancer do exist?
Okay, it's not so much type. Cervical cancer is cervical cancer. So we call them stages. Okay.
Stages.
So broadly, I think any cancer has 4 stages, whereby 1 is the least, and 4. 4, you normally hear, I think, this dreaded word called metastasis.
Yes, a big one.
Yeah, it's a big one. Okay, so by the time we're saying somebody has a stage 4 cancer, it means that they have, now the cancer has left the primary organ where it started. So in our case, cancer of the cervix, that is the mouth of the uterus, it would have left the cervix and has gone to other places. So we have, for cancer of the cervix, we have what we call local metastasis. So if it's in the rectum or in the bladder or the urethra, those will be local metastasis. And then we have distant metastasis. The most common for cervical cancer will always be the liver. So you find whenever you're screening a patient, we can also go to the chest. We'll always have things like abdominal ultrasound. So you're wondering, why am I doing an ultrasound to see the liver? And yet the issue is in the cervix. It's because if you have a distant metastasis, the first place it's going to look for, it's your liver. Yeah.
Okay. I want to bring you in, Rose. Now you've been told, first tell us what stage were you told you were at, and then did it affect you emotionally? What was going through your mind at that time?
Yeah, it was stage 1B. Now Dr. Maureen akaniambia tunaenda kufanya operation in 2 weeks. I was crying, confused. Ananiambia kaa chini, you must do this. So akaniconfort na akaongea tu na company doctor. Akamwelezea na Rose amepatikana na hii na tunatakana tufanye operation kwa muda wa wiki 2 ndio isi spread. But I was so confused. Now nilikuwa nimeenda na my daughter. Nikitoka nje najaribu kupanguza machozi but inakuja tu.
Because the word cancer is a big word.
So tukitoka pale Nairobi West, by that time hiyo bridge haikuwa. So nikicross barabara nishtukia tu mtu amesimamisha gari karibu na mtu. My daughter ana scream, "Mommy please, mommy please." Ni nini? Sikuwa nimemwambia. But tukaingia matatu, nikamwelezea na nikamwambia nataka iwe secret. Sitaki tuongee na anyone, even daddy. So I called my sister, nikamwambia njoo haraka kuna emergency, nikamtumia transport. Akaja nikamwambia now nimepatikana na cervical cancer na mimi ninakufa. Aje, nimepatikana nayo cancer, watu hawaponi. So hii maisha tunaishi. Nikaanza kumweleza nimewekeza kitu fulani pahali, unaona.
That's where hapo ndipo ulifikiria.
Yeah, nilifikiria kifo. Unaona. But I thank God my sister ni mtu ameokoka. Sasa alianza kwenda na mimi step by step, tukiongea, tunaongea na Dr. Maureen, anatu advise what to do, tukaenda tukabook, na aka-organize team. Hapo ndio tulimit pia na Dr. Amin, na nikafanyia operation, nikarudi check up. Dr. Maureen akani hand over kwa Dr. Amin, kwa sababu sasa ilikuwa niendelee na oncologist.
Okay.
Yeah.
Now for you, Christine, for her, she thought kifo sasa. For you, what was going through your mind?
To me, you know, when you go for the biopsy report, it takes like 2 weeks so that the results to come back. So for me, while I was in the ward for the blood transfusion, because I said earlier that my blood levels had gone to 4. So I was just busy in the ward. I was the one who was I was excited there, giving the other patients food. Now when my results came, that Christine, it was cancer, I shut off. The other patients, they were wondering, what is wrong with our caregiver today? I shut off. I just took off all the blankets and I shut off. I didn't want to talk to anybody. I didn't eat on that day. So I was thinking of death. When my hubby came, I told him, now you go look after my children, and if you've not taken dowry to my home, you just go look for even the smallest, I don't know how I can say in Kiswahili. Yes. That way, enda tu tafute hata kakitu, patia mama yangu, yani usikue na aibu. We had not even built. Now it's like, we enda tu jenge huko nyumbani tu, huko mimi ninakufa. We hata watu wakikuja my funeral isikue ya aibu. We enda ujenge, at least I'm dying.
But you know, surprisingly, it's 10 years later.
Yeah, I only saw death.
Yes.
Now it's a nurse who came to me. Then she came, Christine, why are you so down today? Then she had a talk with me. Christine, there's hope for you. That cancer is not a death sentence. There are treatments, chemotherapy, radiotherapy, and even finally there was surgery. That's what she told me. Then lucky enough, I went for those treatments. I went for the chemo. I went for the radio. Once kwanza when I was hearing of radio, you know these terms radio.
They're huge terms.
Yeah, they're huge. They're huge times here at radio. Then in Kiswahili, when you translate, ni kuchomelewa. So as in unachomelewa how? I was thinking of welding.
Oh my goodness.
I was thinking of kuchomelewa. You see now those welding. Na nini? Ati nachomelewa na stima. Me. So by the time I was taking that courage to start the treatment, I was like, gosh, my God, nenda kuchomwa na stima.
Oh my goodness. Now those are the forms of treatment that exist. So, but before we continue, Daktari, you've said going for screening. So what does this screening entail? Because I've had this, pap smear. How uncomfortable is it and what is it? Okay.
What I I normally call myself a pap smear whisperer. A pap smear, I think a lot of it's psychological in terms of, I'll just say it's some minor discomfort during the examination. A lot of people can actually feel pain during the examination because they're tense and they're not allowing for the examination to take part. But if a patient is very comfortable and you're able to get them to relax, it's just some very minor, discomfort during, because I don't think anyone particularly wants to be examined in that particular region. It's a very private place. We'd like to keep it that way.
You know, they're lucky they had Dr. Maureen. It was not, a gentleman. It can be more uncomfortable when it's, a man doing the test, the screening.
Yeah. In terms of screening, we actually have 2 types of screening. So we have the normal pap smear, and we have something called a HPV screen, which is getting more and more traction, I think, over time. Maybe the pap smear may become obsolete because the advantage of doing the HPV screen is that a patient can actually take that sample for themselves.
Okay.
Yeah, unlike the pap smear.
Oh.
But we see. But in terms of determining whether there are cervical changes on the cervix, a HPV test cannot do that. So I feel until we come up with something else that's still able to detect that, the pap smear will still be here for quite some time. Yeah.
And she moved ahead and said that after the screening, she was now scheduled for an operation herself. It's now radiation. What are the forms of treatment for cervical cancer that exist?
So I think for Rose, her case was very lucky. We're able to pick it up when it was still very early. So normally the cutoff is a 2A. Okay. So remember we said that there are 4 stages. So, and even those stages, they have subgroups A, B. Some cancers even have C. But basically you have, it's one that will be an AB, 2 AB, like that. So that's how it goes. So unless something has changed overnight, the cutoff normally is 2A. So 2A is what would be called, it's still like early cancer, whereby we're still able to operate. So the beauty about getting early, it means that we're able to remove all the cancer tissue. And as you can see, for her, it was a correct diagnosis.
Yes.
She's still with us today because it means that we were able to remove all the cancer tissue, and she has cure.
Yes.
Once somebody from date of treatment, they've gone more than 5 years and they're cancer free, we say that she's actually cured of the disease.
Of the cancer.
So I think probably it's just also our colleague, unfortunately, we also lost him. I think, I don't know if you're aware. Dr. Min. And as we said, we're in the era of subspecialty. So we have what we call gynecological oncologists who are now the specialists for dealing with cancers of the reproductive tract.
Okay. Let me get back to you, Christine.
Yeah.
Sasa
Radiotherapy.
And then you thought sasa umechomelewa.
Yeah.
So what are other challenges that you faced during your time, your treatment?
Financial challenges. Cancer comes with its own burden. When it started for the treatment, mostly when somebody is diagnosed with cancer, it's about the family thing. Because the burden of cancer, you cannot have it all alone. So at that time, I was just a casual laborer. So having talked to my family members, they could not afford it, because going for one chemotherapy was like one session was going for 30,000. One session of radio was going for 10,000. At that time, I was not financially stable, so I just had to go back to my boss, because all my family members were like, no, cancer has no treatment. You are going to waste our money. You are going to raise her. How will you start the Arambes? Cancer has no treatment. So others were like, there's no need of wasting money, because at the end of the day, you are going to die. So why waste our money for your treatment? Then again, waste our money for your burial, for the burial expenses. So everybody was like, not me.
Not you.
Everybody was shutting off. Yeah. But now I took that courage. I said, no, I can't die. I had my son. By that time, my son was in class 2. My baby, my son, my other son was 2 years. I had a small baby for 2 years. I was like, God, no, I won't. I'm going to fight for my children.
Yes.
I went back to my boss. At that time, the famous tycoon Humphrey Karaoke was my boss. So I just had to go back to my HR, who was Irene Ogola.
And they came through for you.
Yeah, they came through for me.
All right, that's quite a bold story there from you, Christine. And that story now sets us up for our second commercial break. Well, when we will be back, we'll bring you so much more on how now we can prevent cervical cancer, and we'll get now to hear from our two champions on how living with it and what advice can they give you and me as well. Do not go too far. Keep it TV 47. Welcome back. This is Body Garage here on TV 47, and on this episode we are all about raising awareness of cervical cancer, and with me is Dr. Maureen Owiti, as well as Rose and Christine, who are champions of cervical cancer. So before the break, Dr. we have touched on the treatment options that are available, and one would be wondering, how long can cervical cancer go unnoticed?
Unfortunately, it's something you can't put specifics, because each individual comes with their own baggage. So if you find, let me just compare, remember I talked about people with HIV are more prone, how the disease would advance in that sort of person would be different from somebody who has no HIV. And even just listening to Christine's story, it almost brings tears to your eyes. I think she must be coming from Western, because I look at the values.
Yeah, right.
Yeah.
The values she has ni ya watu wetu. And you look at that, people are even more concerned about raising money for a funeral than keeping somebody alive. And it's the challenge of really have to look at it. And for me, what I like about her is that she has that will to live, that will to survive. Agreeing that it's not necessarily the only recipe, but it plays a very important role into how there's going to be disease progression. I don't know who is going to ever find these markers, but there are a lot of people who actually even kill themselves psychologically because you get a disease like cancer and you decide it's the end of me. You go hata unaandika will, ufunga vitu, nenda nyumbani, umekufa, na kweli utakufa. But if you look at, for her, she had, as you said, those triggers, that will, that my baby, and because of my baby, I'm fighting this, come what may. I don't know what it does, whether it slows disease progression, I don't know. So it's very important. So I think for all of them, what I look at because it has not really come out very strongly, is the issue of what is the psychological support and psychosocial support that we're able to offer to our clients. And I think that's one area that really, as a country, we need to look at it and improve, because psychologists are there, psychiatrists are there, but she pointed another very important thing, cost. Whether anybody likes it or not, good health care. And please note the word good. You can get health care. Not necessarily good. Good health care costs money. So it's something, I think we have moved to the famous shisha stories. And I would really hope that people who are in decision-making places for the social health insurance, if they can hear and really just put a lot of that money, we are going to be contributing a lot of money to support this project, that they also put that money back so that patients are able to access care. The moment people are able to access care, as you can see, we have survivors here. And what she's talking about, Christine was in a public hospital. So it's not to say that as public hospitals that they're doing a bad job. I believe majority of healthcare providers are actually very skilled, well trained in this country. We know what we're supposed to do. And when the information age, even if you don't know, you just open Google, we go to the correct site, and what you're supposed to do is there for you.
There for you.
So the information is there. Enable us as healthcare workers to be able to provide our patients the correct care. And we do that, we're going to have success stories like this. And I'm so proud to be associated directly and even indirectly, because Gwako is my colleague from Kenyatta.
Okay.
Nice.
Still alive.
Success stories here. Nataka nije kwako, Rose. Now, after the operation that you had, could you tell us how has it been living now after the operation and living with cancer, cervical cancer, and now you call yourself a champion and a warrior? How has that journey been like?
Okay, the journey haikuwa that easy. Okay, to me,
especially after now the operation.
Yes. After the operation. Sasa unaenda radio, chemotherapy, brachytherapy, kama kawaida. And to me, the journey haikuwa easy because venye nilikuwa naendelea na treatment, my husband pia akaanza kuwa mgonjwa. Alikuwa mgonjwa before me, akienda hospitali anaambiwa ni pneumonia. Na nikamuadvise aende afanyiwe CT scan. Akapatikana yuko na lung cancer stage 4. So ilibidi niache matibabu yangu, nianze ya mzee. Na tukapoteza everything. Penye Christina alikuwa anasema. So tukaanza kuuza kitu one by one. Na stigma kwa society sio rahisi. Tuliambiwa tumekasiwa. Ni familia yenye imekasiwa. So familia ilikuwa inatutaka. Na after kumpoteza mzee wangu nikapoteza kazi yangu pia. Sasa nikabaki na watoto mpaka nikaingia depression. Hata nijaribu kucommit suicide twice. Kwa sababu haikuwa rahisi kwangu. But I thank God. Nilikuja nikamit survivor. Nikakuwa na ile nguvu, kumbe mtu anaweza kusurvive. So nikarudi kwa treatment. Na imenifanya niwe strong. Even nimefungua my support group ya CBO. Inajiita Jidhamini Shujaa. Jidhamini Shujaa ni group ya cancer patient, survivor and caregiver. So tuna offer ile awareness yenye nilipewa na ikafanya nifanywe early screening. Nifanywe screening patikane early stage. So huwa tunafanya awareness sana sana kwa jamii uko vijijini.
Okay, I'm sorry for cutting you short, but I'd want first to hear from you, Daktari. Are there risk factors for cervical cancer that make someone prone to getting it?
Okay, so I think we had touched briefly, and the most common would be any form of immunosuppression.
Okay.
And in our part of the world, being HIV positive is a very big risk factor. People who have things like diabetes would also be at risk because it does reduce their immunity. Taking alcohol, smoking, those will be the risk factors.
Okay.
And of course, lifestyle. So you find like, what are they called? Commercial sex workers would be at a higher risk. And reason being, especially if they're not using protection. Remember we said that the human papilloma virus, for HIV, it is protective to use condoms. But even use of condoms, you can use a condom and you will still get human papilloma virus. So it's more virulent, it spreads more easily than even something like HIV. So those people who would be at risk of getting cervical cancer. But I think for me, I'm somebody, as a healthcare provider, our message should always be a message of hope.
Okay.
And the message of hope, I look at, we recently lost one of your colleagues, I think you're aware, Catherine Kasavuli. We grew up, for me, Catherine Kasavuli was somebody I grew up on screens. I think KTN was the first private screen, and that was when I was a young girl. So I felt very, very sad as a healthcare worker that we could lose someone of that stature to a preventable. So cervical cancer, I would say, is a good cancer from if you can call a cancer good. From point of view, we can prevent it. Very few cancers can you say, can we prevent this? So again, and that's why I keep deviating, I want the message be, we can prevent cervical cancer. We prevent cervical cancer in several ways. The first is government rolled out free vaccines for girls aged 10 to 13. I think they've expanded the age group. So please, you have young girls and even somebody who's above that age, you can pay. Your health is more important than a few coins. So, but it is free. Please, can we take our young girls for vaccination? So that's one of the ways of preventing cervical cancer. Again, the screening. In her case, she was found to have cancer 1B. We get pre-cancerous changes. We can treat those. You don't even need to go for extensive surgery to survive, okay? And again, in case we missed all those, whatever, if we catch it early, we have a perfect example of somebody who has survived because the disease was caught early, and the only reason it was caught early was because of screening. She said she had no symptoms.
Yes.
Zero symptoms.
So how often should someone go for screening? So
screening, we normally say, previously to be yearly, but currently we're saying at least every 3 years. Somebody should have a pap smear done.
Okay. I would want to hear from you, Christine. Now, living with it, did you have to change something about your lifestyle, and how have you lived with it positively?
Okay, once you're diagnosed with cancer, it's you alone. First, you get stigma, even from your closest friends, relatives. So after treatment and all I completed the treatment, I had to go back to my God. I had to change my ways. Because mostly you can hear people saying that mostly the religious part of it, that you should go back to ani unafaa umrudie Mungu wako kwa maana ulikosa. So you hear such voices say that, oh God, kweli ninafaa niseme, I have to change. Then you hear the myths of cervical cancer. Maybe you hear that cervical cancer is caused by having the sexual part of it, which is not good. To hear the stigma part of it, that it's caused by sexual partner. Then it's like, no, you are like, no. How? And it comes with shame.
Yes.
So that shame keeps you back to reflect on yourself. So how do you live with it? You live with it positively.
Yes.
That I survived, yes. People are talking bad ill of me. Yes. What do I do? People are stigmatizing me. Yes, what do I do? I'm living because of my children.
Yes.
My family members, the ones who are talking to me, it's fine. Those who are not coming to me, it's fine. I'm here because of me. Not even my children now. It's me with my God. So that's how I changed my ways. I went back to the community. Now I went back. I had to create awareness back to the people, to the society. I even joined the guidance and counseling course at Amani Guiding and Counseling Center, just to go back to those people, those that were left, those that were those that people talked ill of them, that cancer, you'll die, that you're cursed. Because cancer comes even with the emotional baggage with it, that you're going to die, that you are not. Then cancer comes also with that feeling of hopelessness.
Yes.
When you have cancer, you feel hopeless. You are no longer economically productive. So what do? You keep to yourself, because even if you go out there looking for employment, the first people that are going to stigmatize you, the first person who is looking for for you for that employment.
Yes.
That I could have given you employment, but now that you have cancer, are you able to do it? You know, people are even judging you. They have not even given you that chance
to even try.
To even try.
Okay.
Yeah.
That's your 2 cents, Christine. Labda nije kwako Rose, katika sekunde 30 uniambie ushauri wako kwa mtu ambaye bado haja go through the screening ama ambaye amepata tu kwamba yeye ako na cervical cancer. Kwa sekunde 30 ushauri wako kwake ni nini?
Okay. Kwa mwenye hajawahi kwenda screening, ajaribu aende screening. Ikipatikana early stage, matibabu ni rahisi na pia kuna ile nafasi ya kuishi pia. Mimi ninaweza nikawa kama mfano. Na kwa mwenye amepatikana nayo sio mwisho wa maisha. Ninaamini kwamba ukianza treatment, najua kuna watu wana advice watu tofauti. Nenda kwa dawa ya miti nini, nenda treatment, enda hospitali, ufate maagizo ya daktari, utapona.
Utapona.
Yeah.
Indeed. As we wind up, Daktari, in 30 seconds, can cervical cancer recur and can it be cured completely?
Okay, any disease can recur. I think for Rose, we have an example of somebody who was cured completely. As we said, the earlier stages, those were able to do surgery for, we can eradicate the disease. I wish you'd give me more than 30 seconds because I'd like to really clear stigma.
Okay.
So even that human papilloma virus, majority, more than 75% of the population have it. So the only difference between I probably have HPV, you probably have, everyone in this room probably has HPV, okay? But the difference between her is just probably her immunity is not so strong to mount enough defense to stop it from progressing. That's the only difference. Did she do something wrong? No. Is there something bad about her? No. So I think I'd like to really dispel the issues of stigma. And I think even for all of us is how do we ensure that we are able to integrate all survivors, that they're able to be productive if they want to be, because until you leave this earth, you're able to do something. People all have, and we don't know. Hers is cancer. At least the only difference I can say is that maybe if at all it had progressed and not something able to cure you, you have time to put your affairs in order. The rest of you, do I know we're going to be hit by a car tomorrow? You're not there.
No. All right.
Yeah.
And as we now spread this message of hope and raising awareness, Daktari,
Go for
let me
screening.
add you 30 more seconds to tell me your parting shot to my viewer.
My parting shot was my first shot. Please, can we prevent cervical cancer? Prevention is through vaccination, through screening, and also behavior change.
Behavior change.
Yeah, so, yeah.
All right. Thank you very much. I have had a very enlightening moment hearing from you, the champions, as well as you, Daktari. It has been lovely having you. And I hope that you back at home also do have, you know, some of the do's and don'ts. And as Daktari has said, go for the vaccination as well as the screening. Till next time, thank you for keeping it TV47 and of course Body Garage. I am Sheila Chelangat. Do have yourselves a lovely night.